very warm welcome
to
our first ever Concierge Medicine podcast, which I gave the title Healthspan TV as a series of podcasts we want to do on the subject of longevity, lifestyle medicine, and really sharing philosophy and best practice about staying healthy. And I wanted to kick off with Eugene because you are in many ways a role model for me as a patient, as a friend, and as a really educated person when it comes to your own health. And I would like to start with you maybe telling us a few words about yourself and your background as an entrepreneur, and to set the scene and take it from there.
Sure. Firstly, thank you very much for inviting me. I feel privileged. It's great to be back here in Prague, one of my favorite cities in the world, without a doubt. So my name is Gene Browne. I'm 55 years old, almost, and I'm from Ireland. I was born on the west coast of Ireland. Today I live between Ireland and Italy. I have been an entrepreneur probably for the last 30 years. Recently sold my business, and I'm at a stage now in my life where I think I'm putting as much focus into my health at this point as I did into my business when I was in my late 20s. Because I think in your 20s, you can get away with a lot health-wise. You're young. You've got an incredible metabolism, most people. And you can suffer a lot of abuse. You can abuse your body in the 20s, which you cannot do in your 50s. So now with the same focus I had on business in my late 20s and my early 30s as I was building a business in 40s, I put a lot of that energy right now into my health to make sure that I'm going to be around as long as I can, and more importantly, as healthy as I can. I joke that I have a 50-year plan that'll bring me to 105. But I want to do it in the most healthy way possible.
Great summary. Before we do a deep dive into the subject of health and longevity, your story and background as an entrepreneur is fascinating. Can you tell us a little bit how in your own industry you introduced service as a differentiator to a new level?
Okay, so my background is a quality engineer. That's what I trained as. I trained first as an industrial engineer, then production engineering, and the natural progression to that was the quality engineering. And I think the quality engineers of the late 80s, early 90s were the data scientists of today. So I was very fortunate to have that skill set. My first kind of proper jobs after college were as a quality engineer, quality manager, first in a manufacturing company, then after that in a service company, and my role was implementing quality management systems, ISO 9000, in particular 9001, to these companies. I enjoyed manufacturing, and the whole quality movement started primarily out of manufacturing. But once I tasted the service industry and the quality management in service industry known as service quality, that's where I really found my calling. And for me, service industries are amazing because they're very unforgiving. When you have bad service in a service industry, you don't get a second chance to put it right, because generally, unlike manufacturing, in a service industry, the customer and the producer are there at the same time. When you're getting your meal in the restaurant or the deli or whatever, you're getting your haircut, or when you step on the airline or you meet a customer service rep somewhere, if something goes wrong, you can't pretend it didn't happen. So it's very unforgiving. But the companies who do it exceptionally well generally go on to make, in my experience, higher margins and deliver something really, really special.
And your industry is not known for service, isn't it?
Yeah, the industry that the business I was the past 26 or 7 years in is the waste management industry, and I had
removing bins basically from businesses and households,
collecting waste and removing it from households and businesses, etc. And I had zero background in that. I mean, if you told me 3 months before I was in the waste industry that I was going to be in the waste industry, you may as well have told me I was going to be a nurse or a fireman or something. It was completely off tangent. When I stumbled across that industry along with a business partner at the time, Glenn, a good friend, I knew this was the best move for me and for us at that point, because here was an industry with extremely bad customer service. So you could look good quickly because you could bring the various things that I had educated myself and I had learned in my career to that point to this bad industry. But it's changed. The players in the waste industry today are very different than they were 30 years ago.
Partly thanks to you, because you raised the bar and they kind of trying to catch up, isn't it?
Yes, so it's said that we did, and we probably did. And when you do new things and innovative things in any industry, you drag the competition on your coattails. And the problem with that and the excitement with that at the same time is that you got to keep innovating. So suddenly you're doing something new. Next year, everybody's doing it, and it's not new anymore. So you're always looking for the new thing. And that's
why I said you are my role model, because healthcare is not so dissimilar. Because for many people, healthcare is not necessarily something they would immediately associate with great service, because healthcare is often provided by state hospitals or state institutions, and especially in Central and Eastern Europe, it's often seen as a something you take for granted. But on the other hand, you not necessarily get treated like at a 4-star or 5-star hotel. It's sometimes a daunting experience to go to a hospital or to a doctor's office. So that's where I take a lot of inspiration from you to actually position healthcare also as a service champion, as really raising the bar and making patients and members fans of the brand and raving about it. So I take a lot of inspiration from you, and that's why we also have very fruitful and interesting discussions about the topic of service, because like you, I'm a service fanatic.
Yeah, interesting comparison. I think with any service business, in my mind, the way I look at it, if I'm paying for a service, I expect a good service. I expect reliability. I expect quality. And even today, quality, and we discussed this before even we went live on air here, we were saying, how quality and reliability are two different things, okay? Reliability is how you measure quality over time. Sure. Is something good today? Is something good in 1 month? Is something good in 4 months? Is something good in 6 years? Sure. And I think today, it's moved from quality to reliability, and it's actually gone a step further even. In my mind, it's gone past quality, past reliability, and it's now in convenience. So the customer doesn't want. The customer absolutely expects quality. The customer now expects reliability, so the service 100%. Over time is going to be consistent. And not only do they want a consistent service over time and a quality service over time, they want it to be convenient. They want it when they want it. They want to be able to go online and book it. They want to do all these things. So to go back to healthcare, yes, you're right. Some people think many people think, healthcare is daunting, it's scary. There's another problem as I see it. There's a significant proportion of people who don't want to know, even friends of mine, right? When they hear that, okay, I go to this clinic because I want to find out X, Y, and Z, they say, oh, well, I'd never do that because I never want to know. So that's another conundrum with healthcare that's generally not there in the regular service industry.
And this is where also education plays a big role of what I try to make our mission to tell people, yes, it can be scary to go through tests, but if you have a well thought out routine, repeating time interval, you're going to find out things like cancer at hopefully stage 0 or 1 when it's still highly treatable. Same with heart disease. And we're trying to take the edge out of it to say, yes, it's scary, but it can be the best thing you ever do for yourself to learn it at an early stage when it's still preventable. Because when cancers are not treatable anymore or have very high mortality is stage 3 or 4. And I agree, this is where you don't want to find out. But with a well thought out plan and prevention routine, hopefully you never get there because you find it out when it's even pre-cancer. And we get to, because we are philosophizing about this new methods, we get to the topic. But I think this is something where a clinic or the customer service also plays the role in terms of education to take people by the hand or give them as much support as they need or want to potentially save their life, because there's nothing more powerful in medicine than knowing early.
I can't imagine myself personally not wanting to find out. I think it's the engineering in me. You'd always want to find the defect as early as possible on the production line so you can make the intervention that you need to do. You also want some sort of system so it's non-recurring if you can find it early enough. And if it's go back to the business analogy, it's too late when the product is shipped to the customer to find the defect. The cost of getting that right, the rework as we'd call it in business, is huge. And it's the same with your health. And it takes a certain mindset, I think, to want to do it that way. But going back to my own story, it's easy to say that there's a certain thing that happens when you get into middle age, right? Even though the middle age is now moving because people are living longer, so it's hard to define what middle age is anymore. But when you get to a certain point in your life, you realize it's not so easy to fix things health-wise. You also realize your own mortality. When you're young, when you're in your 20s, 20 years into the future seems like an eternity. But when you're in your 50s, you look back 20 years, it's like yesterday. It's like it went with the blink of an eye. So at a certain point, you become more aware of your own anxiety. In my case, the trigger was the death of my mother at 65, and we may come on to that. And that made me realize my own mortality because she was barely 20 years older than me. So then you got to think, well, okay, if that happened to her, how do I know that won't happen? Like, there's a good probability that can happen me. So now I better do something about that. Right, so right. I think that probably was a catalyst in my journey.
And I remember it very well. And I remember this was really the time, you're absolutely right, when you became keenly interested in the subject. And when we had a discussion on what is out there to do, because you wanted the engineering approach and so on. So maybe can you share your first experience? I believe that was in Düsseldorf when you did initially the whole variety of a full day of diagnostic tests, and what the experience was like and what you got from it. And
Sure. So just to go back a small bit, I think my mother died of cancer, a carcinoid tumor, which is very rare type of tumor. And she also had diabetes too. So that's kind of 2 of the 4 big killers, yes. Right? You know, I think it's 80% plus of people die of one of 4, kind of the 4 horsemen, they call them, right? So if you don't die in a car crash and you don't die in a freak accident and you don't die of something rare disease, the chances are you're going to die of heart disease, you're going to die of cancer, you're going to die of diabetes or some metabolic dysfunction or Alzheimer's or some other disease like this. So she had 2 of the big 4, and she was only 65. But what was interesting was what the doctors had said was the tumor that she had, the carcinoid tumor, it's a very slow growing tumor. And her claim to fame was that's the same one that Steve Jobs had, right? But they reckon she had it for 8 years before she realized she actually had it. Now, if she was of the generation or of the mind where you'd take your healthcare from a preventive approach and you'd say, oh, you know what, I feel fine, I feel 100%, but I'll just go and do a full body MRI scan. Yeah. If that technology was available to her, and if she was of the mind to do something like that, there's a good chance she'd be alive today, because you can find something like that very early. And people with that type of cancer can live 18, 20, and 25 years with it. Yes. You can die with it rather than from it. So that got me thinking, okay, so look at, if I have the means, and the world is now a much smaller place, so I did my first full body MRI. I went to Radprax's clinic in Dusseldorf, which is located at the airport. It's convenient for the international traveller. They told me I was the first Irish person that ever went there. The main clients were, at the time, Middle Eastern and Russian.
Yes.
I was in and out in a day. They did the usual full checkup, the bloods and that you do kind of anywhere. But on top of that, I went into a MRI machine, probably for over an hour, where the MRI did what the MRI does. And afterwards, I had a consultation with the radiologist, but really, it was a really holistic debrief in terms of from the top of my head to my toes, and showing me huge 3D images and going through, looking, identifying many things that I didn't know. I discovered on my first MRI that I have a 5 centimeter tail gut cyst.
Again, very rare.
Very rare.
Exceedingly rare.
Exceedingly rare, but I have one. So that anyone that's listening or watching, that's the, we're all born with a tail, as we were millions of years ago. But in 99.99% of people, this tail falls off in the womb. In my case, it didn't. And it's pretty benign, generally, and it doesn't grow any further. But if it does start to grow, it's generally you're in your 50s or more, and then it can become cancerous.
Yes.
But there's no way of discovering this unless you do an MRI.
Yes,
and when people by the time people discover that there's something wrong, it's already too late. It is already moved on into other organs, and it's very difficult to deal with. So that if that's the only thing I discovered, that was worth knowing. How do I deal with that now? I have a pelvic MRI once a year. And the doctor that I have that looks after that, the colorectal surgeon, says that, okay, it's a very difficult operation to remove that, and there's absolutely no need to remove it unless it grows.
Yeah, so it's a watch and see approach.
And see. Every June, I have it. If we see it moving, we'll take it out. But at least if it moves on me, I'm ahead of it.
Yes. And this is really the fascinating part, your engineering approach to your own life. And we always say in concierge medicine or in a concierge medicine setting that we want to empower the patient to be the CEO of their own health. And really, this is what you've done to look at the baseline, but it didn't end there because you got the result. And I remember then you and I were talking and we were saying, okay, what does it mean? Because as it is often in medicine, you get the result but you want to know more. So we were reaching out to the Brigham and Women's Hospital in Boston, and something which we as concierge medicine do as a basically part of our membership and brand promise is that we look then what is next and what to find out the best possible specialists internationally to educate the patient to actually make up their own mind, because I think that was part of the process of you getting to a watch and see approach, that you really wanted to speak with a top-notch international specialist who's seen these cases before, because it's so rare that, for example, in Czech Republic, you'd be finding 1 or 2 cases scattered around the country, probably not even diagnosed. So you need to find someone who's seen this, who's performed operations on that, and so on. So can you a little bit
so
expand
at the
on
time, I did my own research on it, and when I understand how rare the operation was, and I think about 17% of people who have the tail gut cyst, it goes on to grow or be cancerous.
Yeah.
So first of all, it's extremely rare, and within the people that actually have it, like me, then 17% of those cases can go very wrong, particularly as as you get older. So I went to Boston to the Brigham and Women's. I met with Dr. Goldberg, who is the busiest colorectal surgeon
on the East Coast.
In New England, he told me, and this hospital was extremely busy. And I wanted someone, if I have to have this operation, I want someone who's doing this operation regularly, not someone who's going to do it once in their lifetime. But to give you an idea how rare this actually is, at the end of my first consultation, I asked him how many of these procedures he performs in a year, and he said over the last 5 years, he's probably performed, on average, 1 a year, which gave me a bit of a shock. But if he's the busiest guy, that'll tell you how rare it is. But it's good. I have that covered. And
and he gave you the additional peace of mind that the waiting and watching is the right thing to do at the moment. And
in fact, he advised that you would never do this operation unless the cyst starts to grow, because it's an extremely difficult operation, and the chances of something going wrong in the operation is not insignificant. So you only do it if you really have to. And that's how I'm managing that. But going back to the Radprax, the other thing I found out at the Radprax was, and nobody tests for the following. I have extremely high levels of lipoprotein A, LP little a.
Which is a genetic risk factor for heart disease.
Correct. And if you look at me, and you look at my lifestyle, and people who know me say, okay, well, look at this guy, has got to be healthy. You know, he eats healthy, he's endurance athlete, he doesn't smoke, I don't drink a lot anymore. So you would imagine that I am low risk in terms of one of the 4 big diseases being heart attack or heart disease. But as it turns out, no. I have very elevated LP little a. To give you an idea, the guideline says you should be under 75 on this measurement. If it goes over 125,
it's high risk.
You're in a high risk category, and I'm 359.
Yes.
And LP little a is not something you can change. You can measure it when you're 2 years of age and measure it when you're 50 years of age, and it's pretty much going to be the same.
Because it's genetic in background. So
right. And this is where LP little a usually introduces itself to your life as a severe sudden heart attack. And when somebody who doesn't have any kind of symptoms or any lifestyle factors that you would suggest that this would be the case, it becomes as an awful shock. These are these athletes who are playing a game and drop dead and say,
everybody says,
my God, how did he?
Correct. Exactly.
So now, through concierge, indeed, I'm able to manage this as best I can by managing all the factors that go around it. Now, if I didn't have that initial examination, I wouldn't know about the LP little a. And I'd look at my diet and I'd look at my physical activity and I think, I'm fine. And even by looking at your total cholesterol, you can't really see this.
Yes.
Because you can get your LDL way down.
It's a surrogate marker, but it's not really telling you the full story.
Correct. You can get your LDL way down. My LDL is kind of okay at the moment, but my LP little a is off the charts. Yes. And then to go a step further, when they discovered that, they said, well, somebody who has the elevated LP little a, you really need it, if you want to find out what's going on here, you really need to do a CT scan, number one, and a CT angiogram of the heart, and an MRI of the heart. I had them all done. And even when I did the CT scan, I got a calcium score of 0. But that's not telling me anything.
It's not telling you anything.
Exactly. I think I'm doubly great now. I have a CT score of 0. But the problem was when we did the CT angiogram,
you've got soft block.
I have 20% blockage in my left coronary artery.
Yes.
Again, you look at me, you look at my lifestyle, you think,
no way,
this can't
be.
So I'm managing all this. I feel like I'm ahead of the problem. If I'm not ahead of it, I'm definitely level with it. It's no surprise.
Absolutely.
It's no surprise to me. And now I'm looking at what other clinical trials are going on or various other research that's going on in these areas of LP little a.
Because you are on a medication at the moment which pushes down LP little a and LDL. It's called PCSK9 inhibitors. It's monthly injections. And there you have the possibility to reduce your LDL, which is one of the other major risk factors, especially in the setting of elevated LPA. So we are trying to push this down as much as we can and also influence the LP little a, but only about 20 to 30%. So, but lots of exciting things are in the pipeline, hopefully game changers in terms of future treatment of LP little a.
And that'll all feed into my 50-year plan, please God. And that, that's all technical about my story and the things that I found out by taking this approach. But what's really important now, and I think what what as an engineer, now I'm in control. Like you said, I'm the CEO of my own health, as previously being the CEO of my company. So now I decide, okay, I want to come to the clinic in 3 months' time because I want to see how things have improved in any given area.
Because you had an injection today, so in 3 months we're gonna check the result from baseline and.
Correct, but I'm empowered.
Absolutely,
I'm empowered. I'm not subservient in a way that people were traditionally to the doctors or the physicians, and they're great doctors and physicians, and you have great doctors and physicians. But what I'm saying is, I'm not waiting for them to tell me, oh, you should come back here next year, or I'm not waiting to have pains in my chest. I'm like absolutely saying, this is a service, right? Like any service, and this is a great service, and I'm the customer, and I'm coming at this, and I'm paying for this, as you'd expect, and therefore I want to get ahead of this, and I want to be in control of my own health, and I want to use this team to do it, and I'm going to decide at the pace.
Absolutely. And what I'm super proud of is that our doctors, and I see it every time you visit and you consult with them, that they're super open and excited about having patients like you who really are the CEO of their own health and putting their education and their knowledge behind it and really trying to be the partner in your health journey. So we're doing this angiogram in June, and we're going to send it to the US to have some AI-empowered and assisted diagnostic. Can you talk a little bit about what we're doing? And because we do it together.
Yeah, it's extremely new. I think we only discovered this in the last 6 or 8 weeks. And it's a US company called clearlyhealth.com. So they take the results of the CT angiogram, and they upload that into their software, and that's their secret sauce. Yes. And I can't recall how big the database is, but they're mapping this across the data that they already have, and they're looking at in particular, in my case, they'll be looking at the soft plaques, and very very often I think. What I like about it, and I like the software, and I like the kind of CX or the user experience from what I've gleaned online, and the reports that you get. Because too often you go to the doctor, you go to a hospital, and the doctor gets the information, and there's a particular language that goes around medicine. Yep. And there's a particular language that goes around engineering, and there's a particular language that goes around X, Y, and Z. But the language around medicine, most of the rest of us mortal souls don't understand that, and we're not empowered, or we don't have the confidence to ask the doctor many times to explain what that is.
That's in the traditional model.
Correct.
That's if you go to the
exactly. And with your clinic is different, and with Clearly, what I like is it's different. I think the reports and the color schemes. I'm basic. Colors will help. Colors go a long way, and that'll really help me understand where I am on this cardiovascular journey.
The most exciting thing about the AI-empowered or assisted analysis we are doing, as you said, is it will give a much better understanding of your soft plaques, which is the plaques. There's 2 types of plaques. One is calcified. They show up on the calcium scan, or calcium score. And then there's the soft plaque. And the soft plaque are the widowmakers, because they are the one who rupture, or which rupture, and they can produce, whilst rupturing, a deadly clot, which blocks the blood supply to your heart. And there's often little you can do because you got a minute to save the patient. So by actually seeing how severe the soft plaque part of that is, using the AI and using the report, you get a baseline, and then you get a protocol to treat that and to convert that soft plaque into calcified plaque, which is then might still be 30% blockage, but the risk of rupturing and killing you is much lower, which is the reason for doing that, actually, to see what is the Is that
that's
why you do it? Or
that's exactly why I do it, because I know there's 20% soft plaque there. I want a bit more detail on
Yes,
that.
of
Again,
course,
that's
of course.
for me, being an engineer, that's a bit too generic, right? I want to go a bit deeper on that, and and it's funny, I don't have any calcified plaque. Neither of them is good. If you had to have one, you'd want the calcified one rather than the soft one.
Yes.
And how we're going to treat and manage this soft plaque into the future, that's where I'm hoping Clearly can help me. And I don't know
And Dr. Wolfert, our cardiologist, is very excited to see the result and also work with you and using the AI data. And there's an interesting, or there's a nice like phrase I heard recently is the doctor will not be replaced by AI, but any doctor not using AI in the future will be replaced.
Right. Yeah, there's a lot of hype around AI right now, and it's a lot
of it.
You just
downloaded the
ChatGPT, and a lot of it's warranted for sure, and it's very interesting to see how this whole area will develop in the next number of years. But for every business,
and we want to be on the forefront. We want to be the trendsetters. We want to be the if a patient comes through our door, we want to be able to tell them what is there today, what is AI doing and not doing. I don't think it's there yet to diagnose a patient. It passed the American medical exam with flying color, but it still makes mistakes on differential diagnosis, on so on. But it's gonna be a tool. It's gonna be a tool for both patients and clinicians to add to their. It's gonna be becoming more sophisticated by the week, literally at the moment.
It's going to get better and better. Yeah. It's only going in one direction.
Coming back on your fascinating journey in health, and you are like me, listening to all the big thinkers, Peter Thiel, Huberman, to name a few, David Sinclair out of Harvard Medical School, who is predominantly working on longevity and genetics. What did you take away from this sometimes overload of information and sometimes contradicting information, also changing from time to time? You hear some of those gurus changing their own protocols and finding out new things and contradicting each other. So how do you navigate, and how do you distill it down to something you can use on your? I know you eat a lot of pills and you like vitamins and supplements and so. So what's your take home, and what would you recommend someone looking at this program and wanting to do some of it?
What I've come to realize is how individual medicine is, and what can work for you won't work for me. So if you take back to traditional medicine, there's kind of a one-size-fits-all. So you go to the doctor, you have A, B, and C symptoms, and they prescribe X, Y, and Z. It's very general. And because you have A, B, C, and I have A, B, C, it doesn't mean that X, Y, and Z is the right solution for both of us. So what I've tried to work with is what's right for me and for my body type, my lifestyle, and if something has first of all, it's the credibility of the presenter, their experience, their background, their credibility, whether they're trying to push something and sell it from a salesy point of view, or whether it's research-based and that they don't have, kind of commission or skin in the game.
Financial interest in a company they own.
You mentioned Peter Thiel, you mentioned Huberman, and David Sinclair to a lesser extent. I like all three of them for that reason. I think Attia and Huberman in particular are very research-based, and their publications and their podcasts that I listen to are very educational. Then I kind of take that away. I do some of my own research, and then I might try something and see how it makes me feel. But if I don't see any genuine difference or benefit, I scrap it, because you'll waste a lot of money chasing this stuff. So Yeah, I do take a good few vitamins, but no funky stuff.
And what would you recommend to someone who is looking to make the first step towards the journey you did, and they don't want to reinvent it all and reinvent the bike and do all the research from stage one? What would you recommend them in terms of a protocol, of a checkup, or of making sure everything is okay? And is it important to have one doctor you trust who is your advocate, or is it important to have many doctors and get? So what's your recommendation?
Okay.
What's your?
I have two recommendations, I think. The first one, if I had to pick a test to go and do, and I've brought kind of friends of mine with me to Germany, where I went for the full body MRI. But I think I would start with the full body MRI because that's the baseline, and it's about as good as you can get today in the technology. That'll give you an overview if there's something that you need to be worried about. That's where I would start. And coupled with that is exercise, right? You know, I am fascinated by people talking about this supplement, that supplement, and the other supplement, and without even doing any exercise. I mean, exercise goes a long, long way. So I think until you get some sort of exercise regime going, particularly as you get older, you shouldn't even be considering supplements. And definitely the full body checkup. For me, that's what worked. Yeah.
Interesting. Fascinating that you talk about exercise because, as you know, at Concierge, we are focusing on lifestyle medicine. And lifestyle medicine is all about preventing the horseman disease, which kills patients at a stage when it's either already developed and you can often reverse it, or actually make sure it's never going to happen in the first place. And exercise is one of the big pillars. There is exercise, there is nutrition, there's also sleep, of course. Sleep is one of the major drivers of both mental and physical health. And then there is stress management. And all those pillars, which are traditionally not part of the medical evaluation or what the doctor is prescribing you or telling you, because basically doctors haven't been taught that in medical school. It's so important, but it's not part of doctors' education. And this is where we start with educating the doctors. They become members of the European Lifestyle Medicine Association. We went with 15 doctors to Athens this year for a 3-day congress to actually teach our doctors actually what to teach the patients and what to help the patients. So exercise is super important, but it's probably one of the most underappreciated prescriptions, so to say, what a doctor can do good in terms of the patient's health. Health is absolutely true.
I think you're right, and I think your doctor needs to be your partner.
And treat the patient as the CEO of the health.
Correct. And that's the level. It has to be on a peer-to-peer
yes.
level.
One of our key values, you talked about yesterday, about our values at Concierge, and our key value, one of our key value is peer-to-peer, non-patronizing relationships with our patients, empowering them rather than talking down to them and asking them why they have 5 kilos too much and they should exercise more.
Of course, and if I trust my physician in the sense that I feel comfortable, then I'm not afraid to ask a stupid question. You know, what I think is a stupid question, because it's a stupid question that's bugging me, and if I don't get an opportunity that often to be sitting in front of the doctor and one-to-one. So when I'm there, I need to make sure that I ask all the questions, even the stupid questions in my mind.
And do write them down, and that's what you do. And I'm always telling my friends when they come to us or when they come to any doctors, write down the questions you have, because usually you come to the doctor, might wear a white coat, you are kind of stressed from the environment, and you see the machines, and you see and you forget you have a blank, and then you go out and say, I should have asked really about this, which is kind of a strong issue in my family, a lot of issues about heart disease in my family history, and I didn't mention it. And doctor might have not asked the right question, and it's gone. The opportunity is gone. So write it down is always what which you do very well. I mean, you come literally with a list of
yeah, I do my own research in advance, and then I ask the questions, and plenty of the questions.
And the right doctors love it. They really get inspired about it. They really like. I see it, how they get turned, like how it ups their motivation to work with a patient like this is fascinating. Just one thing I wanted to talk about exercise, or tell about my own experience when I was at Harvard Medical School lifestyle medicine education program. There was a fascinating presentation about weight management, and it's probably one of the biggest deterrents of people staying on the ball with exercise. They showed us how difficult it is for people to sustainably lose weight over an extended period of time. But the research is very clear that even if patients do not reach their target weight, let's say they're 10 kilos overweight, they change their lifestyle, they eat healthier, they exercise regularly, but they see, I'm not losing my weight, so it's for nothing, basically. And it's absolutely not for nothing, because it's hard to lose weight. You see it at TV programs, even like The Biggest Loser. Usually these people go through drastic changes in exercise and nutrition regimes. They lose like huge amount of body weight, and then after 4 months after the program, it's all back up. But the mindset, the patient, what really helps the patient is to understand that, yes, losing a few kilos is super valuable, but keeping at the exercise regime is really what helps you staying healthy or reducing the risk of the chronic disease in the long term. Even if you don't manage to raise your or to reach your weight goal, the exercise and the staying on the ball with even short interval of exercise is priceless.
I agree.
So this is my message: is don't get demotivated if you don't lose 20 kilos. Even losing 5 kilos and doing exercise 4 times a week is a game changer.
And along with the exercise, in my experience, it's the nutrition that goes along with that exercise.
Definitely.
And it's not this diet or that diet. And I don't do any of that. I don't follow. I'm
Mediterranean,
keto. I'm just a little conscious of what mindful is the correct word. Yeah, of what I'm eating. And also, the reality is, if you're listening to this podcast and you're 20, like I said at the beginning, you can get away with a lot of stuff. But as you get older, when I'm in my 50s, I have to work twice, if not 3 times as hard as a guy in his 20s.
Of course.
I have to exercise harder. I have to eat. I have to be a lot more particular about what I eat. And if someone, I'm coming to the conclusion that if someone dies in their 80s of one of these diseases, or in their 70s, it's not what they did in their 60s that matters. I think it's what they did in their 30s, how they lived in their 30s and 40s, has a huge impact on how you're turning out in your 80s.
I think even then, if you messed up your life from 30 to 50, mm-hmm. and you then really become disciplined at age of 50, you can make a huge difference.
Yeah.
Because there is studies from the lifestyle medicine community that at age 50, if you start regular exercise and you start a healthy diet or a healthy way of eating, you can extend your lifespan by 12 and a half years. That's if you start at age 50. That's the powerful. Yes, I agree with you. You set the scene in a way for your whole life. Actually, at childhood, how the family raises you, how you eat as a family, and so on. But on the other hand, it's not too late at age 50 to say, I really want to now manage my own destiny, and I want to still play with my grandkids football, at least from time to time, or I want to be able to play golf, or I don't want to be bedridden.
Correct, and I'm the example, because when I was, 20 years ago, I was almost 35. I'm much fitter now. I'm much healthier now, despite the tail gut cyst that I've discovered, but I had that when I was 35.
Sure.
Despite the LP little a that I've discovered, I had that when I was 35. I just didn't know these things. But in general health and metabolically, I'm much healthier now than I was at 35. Physically, mentally, emotionally. You know, there's very few I have less hair, right? But apart from that, there's very few things that I could do at 35 that I can't do better today.
Yes, absolutely.
But that, I didn't realize it back then. And, you know, I do a lot of exercise now. I did my first run at 34. I mean, between 0 and 34, I didn't practically no organized sports. So I didn't start, I was a very late starter in this. But I had to work that bit harder to get there. So if I was smarter, I wish I knew, like everybody, I wish I knew then what I know now. I would have had a different approach to I wouldn't have smoked in my early 20s and in
I can never
secondary
actually
school.
picture you smoking, but it's...
if you go back to the early 1980s in Ireland,
right, it was part of the...
it was when you went to secondary school, I mean, everybody in the class smoked. And people probably find it so weird today, but I mean, I don't know whether it was peer pressure or what.
Yeah,
Same, then you become a certain age and everybody goes to the pub, you know, and that culture is very, very strong where I came from. But, you know, look, it's very difficult. I see it with my own son today. He's 12. I mean, honest to God, his diet is atrocious, you know, but it's so difficult because he's getting bombarded.
Television,
every birthday party is on,
advertisements
on some fast food joint with all his friends, and that's where they want to hang out.
Yeah,
and
yeah.
if you walk down the cereal aisle today,
of course, the choice
Tesco
and
or
the
Carrefour,
sugar,
it's shocking.
Like
what
lures you.
Yeah, of course, and they're all got, Barney and all these TV characters promoting it. So it's very, very difficult. Really difficult. And you also, for lifestyle medicine, I'm fortunate, we're fortunate, I built the business again. The business gave me a lifestyle. There's a lot of people who don't have that luxury. And if you're trying to put food on the table, lifestyle medicine is kind of very far from your mind. And often,
we want to change this one patient at a time, because you cannot change a society. Czech Republic, unfortunately, is the least healthy society in the world. It was published last year in terms of consumption of pork and fatty food and beer and smoking habits and so on. So I have no illusion that we will change the country or but one patient at a time, and we're now starting to actually educate also other doctors. So we're trying to build an ecosystem of aware doctors and hopefully making a drop in the ocean difference.
But education is the key. It's like everything.
Definitely. It's not expensive, by the way. It's about awareness, and fortunately, lifestyle medicine is accessible to anybody. Like lifestyle changes and awareness, but it's not everybody is open to it. Some patients are just wanting medication, and of course we give medication as well. We always follow the guidelines, but we try to add the little extra, we try to find out what is the key weakness of each patient. It could be lack of exercise, could be lack of sleep, and then we have coaches and we help patients to improve, and sometimes the improvements are stunning. And I really think what we preach to our team is the mission to add 10 or more healthy lives to each of our patients. Imagine we have 3,000 patients, 30,000 additional years we can give to our members for them to see their grandchildren growing up and be active and enjoy spring outside, go for a walk. I mean, that's something which is much bigger to drag us out of bed in the morning than making money with a business. So of course, as any business needs to make money, but I think that mission approach. Gene, fascinating talking to you. I think it was a wonderful summary saying it's never too late to get started. Also, as I said, you are the epitome for me as the CEO of your own health. So that's why I wanted to kick off this series with you. Lovely to seeing you in Prague. Thank you very much for coming. And
my pleasure.
I promise you I invite you in 50 years, looking back how we did on your 50-year plan together.
I hope to be here and sprightly and healthy. Thank you very much.